I would say 95% of the people walking through our doors says my eyes are scratchy or they're irritated, or as the day goes on, I feel like my vision's getting blurry. That's the typical things that you hear. And the number one cause for that is a tear film problem. People know it as a dry eye. So you break that down into a water problem, which is dry eye syndrome, an oil problem, which is like a soap, keeps your water from evaporating, and that's called Blepharitis. Fancy word that means eyelid inflammation. It's an overabundance or not the right amount of oil being made by your eyelid glands. And then there's allergies. And allergies, people don't come in saying, my eyes itch. They tell me my eyes are irritated and I can't focus. And that's a mucus problem. But one of those three is usually what the problem going on, and each has their own treatment. When people say my eyes feel worse as the day goes on, that's usually a dry eye syndrome problem, inability to make water. If they wake up and their vision's blurry, that's usually a blepharitis problem. And then allergies, well, that's the big masquerader, because allergies, there's really no timing during the day of having a problem. It's usually more seasonal. Spring, summer, and fall being much, much worse than during the winter. So hearing when people are complaining, specifically the time of the day and the season, time of the year, dictates what we do next. All three, allergies, the mucus component, dry eye syndrome, what you're talking about, what your question's about, the water component, and blepharitis, the oil component. The mainstay treatments is artificial tears. It's not a water drop. It's a combination of all three components. So when you put a lubricating drop in, say it that way rather than artificial tears or watery drop, a lubricating drop will replenish all three of those components. That's the treatment. If we have to go to more advanced treatments, and it includes antibiotic ointments, sometimes a steroid to help with inflammation. So can you prevent dry eye syndrome? No, but you can use lubricating drops and be aware that antidepressants, some cold medicines like antihistamines, especially the ones with the vasoconstrictor like pseudoephedrine, which is in Sudafed, that will dry you out. Stay away from those medicines, your eyes will feel better. Blepharitis, prevention is hot compresses. You have to use a hot compress, soak like a hot compress for 2 minutes, and then gently clean your lids. For allergies, number one is to avoid your environment. But when you live in Iowa, you can't do that. So antihistamines are the start. And I usually start with over-the-counter allergies. Calling our office will tell you which ones to use. If those don't work, then we go to more of the prescription ones, but they work really, really well. So an allergy drop once or twice a day really keeps it under control.